In private practice, we see a disease, relatively benign. They get 3 days of high fever. Fever breaks, they get a rash. It's called Roseola. Can you tell me a little bit about that disease?
Well, it's now known to be caused by a virus called human herpes virus 6. So it's part of the herpes group of viruses.
That's the chicken pox, the regular herpes family?
That's right. Correct.
Kissing cousin.
It doesn't cause the same kind of herpes eruption that people think of with the herpes virus. But this one can actually live inside your white blood cells for a longer period of time, which is why, well, one disease that's also caused by it is the classic rash following a fever, but the other is actually febrile seizures, or what people call fever seizures, in very young infants. So it's actually a leading cause of visits to the emergency room for high fever, and it sometimes results in seizures. That's usually benign. It's not a bad disease like a meningitis, but there's a small risk that that child will actually be at risk for having a seizure again in the following
benign
years.
seizure with virtually no long-term sequelae.
Virtually no long-term sequelae, right?
Just the mental state of the parents.
Correct.
Okay, and it's also the number one misdiagnosis of penicillin allergy, because sometimes kid gets sick, the kid's crying, the doctor looks in the ears, there's a flush of redness to the eardrum because the kid's crying, the doctor overdiagnoses and gives the kid amoxicillin to treat the ear, new double dose something or other, because the kid's irritable, high fever. The parents are happy. 3 days go by. The kid gets a rash. He doesn't even see the rash. He says, stop the medicine. Must be a penicillin allergy. Give the kid Benadryl. And it's probably the most overdiagnosed viral exanthem, viral rash, that we label penicillin allergy. Is that true?
That's true. And then this label sticks with the child for the following several years, so that every time they're coming to the hospital, supposedly they're penicillin allergic, and we can't give them 90% of antibiotics, which are penicillin family antibiotics. And meanwhile, no one actually, as you said, witnessed the rash in the first place, which is probably from the Roseola or many other viruses.
Other viruses.
Right.
And sometimes certain viruses with a penicillin derivative cause a rash, which is not even allergy. Is that true?
Yeah, well, the classic example of that is with infectious mononucleosis, Epstein-Barr virus, where it's been joked that the best way to make a diagnosis is actually give a dose of a penicillin, and you'll actually elicit this classic head.
Oh, it's a cheap blood test. It's actually not even a test.
That's right.
But it's very common. It's not 100% happening, but it's pretty common.
It's quite